Now, given that the Chief Medical Officer has suggested a full outbreak will require more intensive hospitalisation, can the First Minister indicate how many extra beds may be required and what contingency plans are being prepared to commission them?
But it is likely that we will need increased facilities for hospital care, including intensive hospital care, but also be prepared to treat more people in the community who can be treated in the community in order to ensure that our hospital capacity is there for those who need it most.
The Coronavirus Action Plan, agreed to by the 4 governments in the UK, includes a commitment to support early discharge from hospital if active transmission becomes established among the population here. We know from the government's own figures released just 2 days ago that the delayed discharge of patients from Scotland's hospitals has reached record levels. In the last 24 hours, I've spoken to council leaders who are concerned that our social care system may not have the necessary resources to enable patients to be discharged on time at present. So can the First Minister outline how the government plans to alleviate these concerns and so ensure that, if required, the action plan can be implemented in full?
First Minister.
Well, reducing delayed discharge is a focus for the government. It is, regardless of coronavirus, but particularly so given the challenge we face with coronavirus. Reflecting that, the Health Secretary met with COSLA yesterday to discuss this. We'll be meeting with the Chief Officers of Integration Authorities later today.
Can I ask 2 specific questions? Firstly, in relation to bed capacity in our NHS. What further progress has been made over the last week to increase beds in every hospital across Scotland?
A lot of work is going on in terms of how, what steps we might take to increase bed capacity in our health service, looking not only at our acute settings but secondary and community settings as well. And that includes looking at what we need to do and what is possible to do to increase our intensive care units as well.
Thank you, Presiding Officer. The First Minister mentioned progress that was made on delayed discharge, but evidence suggests that many people who are ready to leave hospital are still currently stuck in hospital settings because local authorities are struggling to provide suitable care. I'm sure we'd all agree that the safest place to be if you're fit and able is at home. Can I therefore ask the First Minister how many people are currently in a hospital setting that should not be there, and what specific and direct support will be given to local authorities who claim that funding and resource are the main 2 reasons for cancelling discharge?